Hello, I am Vivian Fragoso, and this is our week 7. We're going to be talking about the urinary system today. So here I have our fetal pit, and I'm going to be going over a few parts of our urinary system here for our fetal pig, and then I'll be going over a very common diagnosis that we see that affects our urinary system. So we're going to go ahead and get started. So I'm going to try to bring this as close as possible. So as you can see here, we have our kidneys. We have our right kidney here. We have our left kidney. And it also shows up on top. You can see it more prominent on our left kidney. You can see the adrenal gland. It is still attached to our kidney here. And here you can go ahead and see our renal vein and artery that kind of connects. You can see it more prominent on our left side. Just from the angle that we're currently in right now. And our bladder here is attached. You can see it right in this area right here. It's kind of attached under our umbilical cord. So I still have it attached for our next lesson for next week. Okay, so we have our ureter, which is here right underneath the bladder. It kind of connects the whole area together. And we have a fat located around our kidneys here. It's like a layer of fat. And then I did open up our kidneys here where you can see inside. You can see our renal medulla, which is right in this area right here. And you could also see our cortex right here. It's very prominent. So if you can get a glimpse of that. So one of the diagnoses that I wanted to talk to you guys about was a urinary tract infection. So that's super common in our family clinics where I work. It'd be a family practice. Typically, you would come in, you would have maybe some tenderness in your abdominal area, pelvic area, some back pain. You might have some pain while urinating. You might need to urinate frequently. And also, you might feel that you need to urinate, but nothing really comes out. So typically in the clinic, what we would do is we would ask for a urine sample. We would check the urine to see if it's high in nitrates and leukocytes, and that would determine whether you have like a confirmed UTI. A lot of the times, if you're already having the symptoms and your urine comes back clean, the doctor will just prescribe you some antibiotics to go ahead and clear that up. So some of the most common causes of a UTI would be through sexual contact, maybe not using proper hygiene, also dehydration, definitely, holding your urine. So whenever you have to urinate, make sure you do void. You do go to the restroom, try not to hold it. Another one would be like feminine products, sometimes lotions or things that you would kind of put down there. It's very sensitive area, so you have to be mindful of what you use in that area. So this concludes our urinary system, and we will see you shortly for our week 8. Thank you. Have a nice day.